So I'm super excited to introduce a new addition to our team, Dr. Andre Ledoux. He's an oral surgeon, and I remember when I first met him, I thought it was the perfect fit for our practice. He comes across as a very caring individual, but he's also very, very straightforward. So it's kind of like what you see is what you get. And as I observed him dealing with his own patients in the practice, it's exactly the same. Patients feel very, very comfortable. They know what they're getting in terms of care and in terms of service. And we couldn't ask for anything more. So really excited to talk to him today. So thanks a lot for doing this today.
Oh, it's my pleasure, Dr. Gallardo. Thank you.
Sure. One of the things, before I met you actually, as I was looking at your background, your academics and everything, the one interesting thing that really struck me was how young you were when you got into the medical profession. Can you tell me a little bit more about that?
Sure, yeah. So I decided from a very young age that I wanted to be in the military after high school. So that's what I did. I joined the Navy when I turned 17 and went to medic school for the Navy, and then also did a specialty as a medic and as a surgical technologist, which is a technician that assists in surgery in the operating room. And so that's how I started off my career in healthcare. From there, I went to school full time and continued my service through the Navy, and eventually got off of my active duty service through the Navy and got accepted to dental school during that time. Completed a 4-year study at Nova Southeastern, and then went on to oral and maxillofacial surgery training, which includes treating diseases both benign and malignant of the head, face, neck, and mouth. From there, I went on to get some subspecialty training in head and neck cancer and reconstructive surgery right here in Miami at Jackson Health System in 2015 to 2017, and went on to further practice in the military, treating wounded warriors and their children and also their dependents.
Oh, interesting. And when you think of an oral surgeon, when you think of an oral surgeon in the private practice setting, the first thing that comes to mind are wisdom teeth. So, one of the things that people tell me when they think of wisdom teeth and oral surgeons, they associate all of that with fear. So how would you say that you make your patients feel comfortable?
Yeah, well, I start off by trying to listen to my patients. Generally, patients have a problem in mind that they'd like to see if there's a surgical cure for. So most importantly, I like to listen to my patients' complaints of why they're here in the practice to determine if there's a surgical solution to get them to feel better and correct their problem surgically if that's possible.
What if you were a patient? Let's say that you were a patient and you needed your wisdom teeth taken out. What would you expect as far as a great experience from our practice?
Yeah, well, I would be looking for the whole package. I'd be looking for a competent, nice administrative staff who's welcoming and can take care of my appointments and things like that the way I need it. I'd be, very interested in having a kind, caring provider as my surgeon, someone who can listen to me and determine if surgery is the correct thing for me, and also counsel me on the risk of surgery so that I could feel comfortable undergoing the procedure.
Oh, good. And do you feel like you're getting that done here?
I think we are, yes. We provide very safe and effective surgery for the patients. We do thorough evaluations and address all the patient's complaints and see if there's a surgical solution. And then we take our time and really try to make the patient as comfortable as possible when they're undergoing the procedure, whether it's awake or under some form of sedation. So we take our job very seriously to try to give the patient a good experience from an inherently uncomfortable situation such as undergoing surgery.
Okay. How about weekends? What do you like when you're not in scrubs? The weekend comes around, you have free time,
Sure.
family's around. What do you like? What do you like to do?
So I like to do all types of things. I have 2 young children, so a lot of it involves their activities and things like that. So I like to watch them go to the kids' soccer games and track meets and things like that, and be their biggest supporter. And when I do have a little alone time, I like to jump on my bicycle, go ride around, or go hiking through the woods, get lost for a little while, and eventually find my way back to get some exercise and have a stress relief at the same time.
Well, great. Well, listen, thank you so much. All of our patients love you. I haven't heard one complaint. It's all good stuff. So thanks a lot for being here and introducing yourself to the community. We look forward to working a lot more together soon.
Excellent, Dr. Gallardo. Thank you. We're looking forward to giving more competent care here.